We have Rachel with us today. Hi, Rachel.
Hi, how are you?
And today you wanted to see me and just ask some questions about augmenting your lips.
Yeah, I want to see how I could do something with my lips. I always use a lip liner, and I'm always over my lip, and I use a lot of lip liner, and I kind of want to look more of a natural look. And I wanted to see what the procedure is as far as like, I know it's injections, do you get bruises afterwards, can I go back to work, things like that.
Just natural.
Just natural.
Well, you know, that's one of the things that I pride myself on, is just being very natural. And when I do a lip augmentation, it really looks very natural. You certainly don't look like a duck.
Well, I heard you're amazing, so they told me less is more. So
less is more. And
practice.
Interestingly enough, I developed a lip scale that was used in front of the FDA to present some of the products to be approved, and I actually have a patent on that. So as far as lip augmentation, that's one of my favorite things to do. My favorite product to use for lips, and I use 9 different fillers actually in this practice, is Restylane. And that's also a product that I was involved in a clinical trial for the FDA many years ago when it was approved in 2003. Great product, and specifically for your lips, because Restylane just flows beautifully right in the, what we call the vermilion. So again, I'm not going to make your lips look awkward, but they will be enhanced. What happens as we age, we lose some of the subcutaneous tissue. It's almost like a window shade effect, where the lip gets elongated and thinned out. So what happens when you volumize the vermilion, and also the corners, and also Cupid's bow, which is sort of the center. It everts the lip a little bit, makes it fuller, but it doesn't make it obnoxiously fuller. So it rejuvenates the upper lip. It's really a very simple procedure.
And how long does that last?
Well, it lasts about a year. There's some variability from patient to patient.
Wonderful.
It also depends on which product you use. Again, in my practice, I like using Restylane, which is a form of hyaluronic acid. It has lidocaine in it, by the way, so pain is not an issue. And I also give you a dental block, so your lip is completely numb when I do the injection. Therefore, it truly is a painless procedure. We do ice it for about 10 minutes after the procedure. You can put lipstick on it right away.
So, just so I understand correctly, like I like the lip to look a little bit bigger on the upper and on the lower, like with my pencil. Then I just want it to be like the natural look. And I did have fuller lips when I was younger.
Of course, and also what I will do to balance the upper and the lower lip, there will be a little bit of an injection on the lower lip just to sort of bring it into balance. And I think that's something very important that we have to pay attention to, because it's really not only the upper lip, but it's also the commissure, or the corner of the mouth, and also the lower lip. So it's really a combination. What's amazing is that just by doing an injection of the upper and lower lip and the corner of the mouth, you can rejuvenate the face, where your friends will say, "You look fantastic. Where did you go? Did you go away on vacation?" You don't quite know what happened, but it makes a difference in the overall appearance of the face.
And how about like if one side of your lip is a little bit lower than the other, you just put less injection on one side than the other?
Exactly. You can correct. We all have asymmetries. Everybody's asymmetric. What I do is I try to lessen that asymmetry. And yes, preferentially what I will do, put a little bit more on one side if necessary versus the other. So at the end, it really is a more balanced, enhanced, and more youthful lip, both upper and lower.
Okay, well that sounds great.
Should we get going?
Yeah, absolutely.